Imagine being told you'll never walk again. For millions of people living with paralysis from spinal cord injuries or strokes, this has been a devastating reality. But what if technology could offer a new form of hope? What if a wearable robotic suit could help them stand up and take their own steps? This isn't science fiction anymore. This is the incredible reality of wearable exoskeletons, a revolutionary technology that is rewriting the future of mobility and rehabilitation. Today, we're diving deep into the world of medical robotics to explore how these bionic suits are giving people the chance to walk again. What are wearable exoskeletons? So, what exactly is a wearable exoskeleton? Think of it as a sophisticated, robotic outer skeleton that a person can wear. It's a marvel of modern engineering combining robotics, biomechanics, and artificial intelligence. These suits are typically constructed from lightweight but incredibly strong materials like carbon fiber and aluminum alloys. They are designed to strap securely around the user's torso and legs, with motorized joints that mirror the natural human hip and knee movements. These devices aren't just passive braces, they are active intelligent systems. Packed with an array of sensors, they can detect subtle shifts in the wearer's balance and intended movements. This information is processed by an onboard computer in real time, which then powers the motors to assist with everything from standing up and sitting down to walking with a natural reciprocal gait. It's a true partnership between human intention and robotic assistance aiming to restore mobility and independence. Who can benefit from this revolutionary technology? The potential applications for this technology are vast and life-changing, but who are the primary candidates for exoskeleton therapy? The most prominent group includes individuals with lower body paralysis resulting from a spinal cord injury, SCI, typically from the mid-thoracic region down. However, the benefits extend much further. Patients recovering from a stroke who experience hemiplegia or paralysis on one side of the body are also finding new hope with these devices. The exoskeleton can provide targeted support to the affected side, helping to retrain the brain and muscles. Furthermore, individuals with other neurological conditions like multiple sclerosis, MS, or cerebral palsy are being explored as potential users. The key criteria often involve having sufficient upper body strength to manage crutches or a walker for balance and being within specific height and weight parameters to fit the device safely. Each case is unique, and a thorough medical evaluation is essential to determine if a patient is a suitable candidate for this groundbreaking rehabilitation tool. How do these robotic suits help patients walk again? The magic behind how an exoskeleton helps someone walk is a symphony of advanced technology. It begins with the user's intent. To start walking, the user typically initiates a forward lean, a subtle shift in their center of gravity. Sophisticated sensors within the exoskeleton detect this shift and interpret it as the desire to take a step. The onboard computer then activates the motors at the hip and knee joints in a precise sequence, lifting the leg, swinging it forward, and placing the foot down to create a single step. This process is then repeated for the other leg, generating a fluid, human-like walking pattern. The user often uses crutches or a walker to maintain balance and control their direction. Modern exoskeletons also feature advanced software that allows a physical therapist to customize the level of assistance. This means that as a patient regains strength and motor control, the suit can provide less support, constantly challenging them to use their own muscles and further promoting neuroplasticity, the brain's ability to forge new neural pathways. Why is exoskeleton therapy a game-changer in rehabilitation? Wearable exoskeleton therapy represents a monumental leap forward in the field of neurorehabilitation. For decades, the focus was often on compensation, learning to live in a wheelchair. Exoskeletons shift this paradigm towards recovery and restoration of function. The benefits are not just about the physical act of walking. By enabling patients to stand and bear weight, this technology can significantly improve circulation, reduce the risk of pressure sores, and help maintain bone density, which is often lost with prolonged sitting. It can also lead to improvements in bowel and bladder function and a reduction in nerve pain and muscle spasticity. Beyond the physiological advantages, the psychological impact is immeasurable. The ability to stand eye to eye with loved ones, to walk across a room, restores a sense of dignity, independence, and hope that was once thought to be lost forever. It transforms the rehabilitation process from a passive experience into an active, engaging, and empowering journey. The future of mobility. What's next for exoskeletons? The field of wearable robotics is evolving at a breathtaking pace, and the future looks even more integrated and intuitive. Researchers are tirelessly working on making these suits lighter, more comfortable, and adaptable to a wider range of body types and medical conditions. Significant area of development is brain-computer interfaces, BCIs. Imagine a future where a user can control the exoskeleton's movements simply by thinking about walking. This technology is already being tested in clinical trials and could eliminate the need for physical triggers, making the experience even more natural and seamless. Furthermore, advancements in battery technology will lead to longer operational times, giving users greater freedom and spontaneity. We can also expect to see the integration of advanced sensor feedback systems that can provide the user with a sense of touch and ground feel, further enhancing balance and creating a more holistic walking experience. This technology is truly on the cusp of revolutionizing personal mobility for people with disabilities. The cost of hope. Are exoskeletons affordable? While the benefits are clear, one of the most significant hurdles to widespread adoption is the cost. Currently, medical-grade exoskeletons are expensive, with prices often ranging from $80,000 to over $150,000 for a personal unit. This price tag puts them out of reach for many individuals and families. Initially, these devices were primarily found in leading rehabilitation centers where multiple patients could benefit from a single suit under the guidance of trained therapists. However, the landscape is beginning to change. Insurance coverage is slowly but sure expanding. In some countries, and with specific providers like the U.S. Department of Veterans Affairs, coverage for personal exoskeleton units is becoming a reality. As technology matures and manufacturing processes become more efficient, it is widely anticipated that the costs will decrease, making this life-changing technology more accessible to all who need it. The journey from paralysis to walking is one of immense courage and determination. Technologies like wearable exoskeletons are not just tools, they are partners in that journey. They are a testament to human ingenuity and our relentless pursuit of a better quality of life for everyone. The road ahead is still long, but for the first time in history, the hope of walking is becoming a tangible reality for millions. Thank you for joining us on Life of Medical. Don't forget to like, subscribe, and hit the bell icon to stay updated on the latest medical breakthroughs.